It was a blessing for this organization to start all of those many years ago, 25 years ago, in order for us to begin helping those children through volunteerism.
It's a magical program. It happened with just such a stroke of imagination and responding to an incredible need.
I just had this feeling that there was a power much greater than all of us put together that was at work.
It is done creatively and collaboratively and cost-effectively, and really is a model that so many communities can duplicate successfully.
From the very beginning of Young and Healthy, 25 years ago, we were born to meet a need that wasn't being met by anyone else in the community. At the time, it was access to medical doctors for kids. That was the need 25 years ago. Well, it evolved. We realized dental was a huge problem, and we started recruiting dentists. Then we realized, oh, mental health issues, those are huge. We started recruiting those folks. Now there's a whole new set of unmet needs, and that has to do with accessing health insurance and then figuring out how to use it. And so Young and Healthy is evolving all the time, and we hope that we're always responsive to what the new needs in the community are.
Ana Rojas is a 7-year-old girl. The original referral came from CHAP Clinic, which is one of our partners in the community. She had a physical, and it turns out that she's had a history of enlarged tonsils and also sore throats for a very long time. She was referred to Young and Healthy because we needed to assist her with an ENT. We contacted Dr. Williams' office, and she was initially seen for an evaluation. About a week and a half later, she went back, and that's when he decided that she needed to have surgery. In less than 2 weeks later, we had set up the surgery. The hospital had been set up, the anesthesiologist had been set up and willing to donate. So in less than a month, this child from the initial referral had her surgery.
Okay, going up. Specifically for her, it was airway obstruction. In some of the patients, we have tonsils and adenoids that are large enough that they're blocking the airway. When your airway is blocked, you tend to have decrease in your oxygenation. As you obstruct, the body recognizes it as a life-threatening event. So it triggers the release of chemicals from the adrenal, what we call catecholamines. Those are the stress chemicals. So the body responds to that by increasing heart rate, increasing blood pressure, heart beats more forcefully. And for those people that have this type of obstruction, they may be going through that type of event multiple times a night. And we're usually trying to correct that.
She never really talked that much. And when she came back to do the cards, the thank you cards, she was really excited and she was laughing and she was talking to me. And I asked her, I said, so how do you feel now? And she's like, I am so happy that my throat doesn't hurt anymore.
I'm very pleased with the way her throat looks.
It did a lot of good for her, and a lot of changes have happened since the surgery.
Ana, you've been a good patient.
Thank you.
You know, we do still estimate that about a third of the children in our community are underserved in some way. There are certainly at least that many who are low income, who come from poor families, who that alone is a huge risk factor for families. And there are lots of kids who maybe they have some form of insurance, but it isn't covering everything. Even Medi-Cal, for all the new people who are on Medi-Cal, it's not going to cover everything. And for the children at least, Young and Healthy can step in and provide services where Medi-Cal drops off sometimes.
You feel very vulnerable because of the way this system is in place. It's this giant quagmire of information and guidelines, and I think that for somebody who's even less experienced in having insurance or dealing with the medical institutions and how best to get things resolved, it can become very overwhelming.
All of these changes in the Affordable Care Act are very complicated. This system is being built. It's like building a car while you're driving it. It wasn't all done. It's evolving. And so we try and stay abreast of all of that new information to help families.
There's so many children without health care, and so many children that have parents that just don't have the idea of what to do when a child gets sick or has a medical problem. And so when I heard about Young and Healthy, I thought, well, wow, this is just such an incredible idea, and it works really well.
Young and Healthy has a staff and people that give their all. They go way beyond the call of duty.
My message about Young and Healthy could be manyfold, but the emphasis that keeps coming to me is the incredible gift that has been given to this community by the medical people, the dentist, the psychotherapist, the pharmacist, and all the volunteers who help the organization.